So we know that when someone is diagnosed with cancer, three of the most common things that they experience are a loss of hope, a loss of control, and a sense of isolation. So at the cancer support community and in so many other nonprofit organizations around the country, we're really devoted to making sure that patients can come together in a community, that they can find hope, that they can connect with others so that they don't feel so isolated. And also we want to make sure that patients find the tools and the resources that they need throughout the cancer journey to be educated, to be empowered, and to really find a path that works for them. We know that there are a lot of barriers to patient participation in clinical trials. We know that there are cost issues, that there are access issues, availability of trials. But one of the things that we see often at the cancer support community is that patients oftentimes don't understand what a cancer clinical trial is. In that, patients oftentimes think that in a cancer clinical trial, a treatment trial, that they're going to get a placebo. And it's just not the case. So we have many patients say, I never even thought about participating in a clinical trial because I don't want to get the placebo. So from our standpoint in the patient advocacy community, we believe that we need to do some basic education, that we need to train patients, we need to give them the information about clinical trials as a starting point so that they think about a clinical trial as a treatment option when they're diagnosed with cancer and not something that's a last-ditch effort or something that they would only have access to when everything else has failed. There's a new emerging trend in cancer care called distress screening, where when a patient is diagnosed with cancer, early in that process, we're screening them for distress to find out what matters to them, what's important, what they're most concerned about, what we can help them with. We really feel at the cancer support community that if we can implement distress screening universally for all patients, and these are quick surveys, questions, 15 questions, 20 questions, if we can implement distress screening, we can really learn from the beginning what matters to a patient, what their values are, what their priorities are, and it really enables an environment where the patient can work with the healthcare team to decide what those priorities are and to make a care plan that's really tailored to that patient.